pleased to say that Pat Kehoe should be joining us now. He's from the Translational Dementia Research at the University of Bristol. What does dementia look like if it's an elephant? Pat, are you there?
I'm here, Ali. Can you hear me all right?
I can indeed. I'm sorry
Hi.
for the faff to get to you. My
No, that's all right.
technology is a wonderful thing.
And it has its moments as well. I haven't got any video at the moment, so I'm going to be padding a little bit as well myself, I think, until I get the video of my presentation
Yeah.
up.
Just tell us a
Um,
little bit about what your title means.
Here we go. So I'm looking at this, considering this is a day of perspectives, I'm looking at this from the perspective of a research scientist. So I'm not a clinician who has a slightly different perspective on things to Dr. Archer this morning. But hopefully, as you'll see in the talk I give now, there's a convergence, at least we're on the same page, which is obviously really important for what we're hoping to achieve. I've got a couple of talking points I want to cover in this, and some of this will unfortunately overlap with some of what Hilary presented earlier, but it's just to introduce people again into what dementia is and how it's a collection of many diseases. I guess it's a scientist's perspective on what we think the situation is now and what's the direction of travel. Dementia and Elephants, as the title is provocatively placed, and it'll remain to be seen if I regret presenting that as a way to present this. Um, I guess I also wanted to explore, why is it taking so long to find a cure? This is something I'm often asked, and scientists and clinicians are often asked. And then finally, maybe what the future could look like for us as scientists, as patients, as carers, and as doctors. So I suppose the first thing is just to, I guess, revisit something. And I know I'm preaching to the converted here, but how big is dementia in terms of a problem to society? And this is a graph generated from a report several years ago and shows the difference between high income countries in the blue colored graph and lower and middle income countries projected to happen up until 2050. So essentially over the next 30 years. And there'll be a much more gradual increase in the number of cases to what we see currently, which I guess is a godsend in the current circumstances. But obviously lower and middle income countries are on a massive catch up, and there's a high expectation for growth in this area in the future, which is quite an eye-watering prospect. And I will come back to that in a moment, but just in terms of, as Hilary suggested this morning, dementia is an umbrella term for many different forms of dementia. We heard the previous speaker talk about Pick's disease as well, which is another form which I haven't represented here, but often you will see
Louis, yeah.
slides like this representing different proportions of the different types of dementia that make up that umbrella. And the different percentages are not there because we're not really entirely sure what's going on. It's more of a case that different studies present different proportions of patients in different clinical samples they may be looking at a different population. So we do have a degree of variation there, which we need to work with. But just to go back to the prospect of what may face us, there is actually some positive aspects to this that need to be borne in mind. Those are predictions based on if we have no successes in future research and in development of new treatments, which I don't think will be the case. And also a significant proportion of people that are represented in this graph tend to be represented by people who have got Alzheimer's disease or vascular related forms of dementia, which are probably the most common types. So if we can make progress there, we can make progress against a significant proportion of cases. What do we know, what do we think, and what can we prove about Alzheimer's disease at the moment? Now, this is a mantra from anybody, actually just a quick segue who's interested in understanding a little bit more about research. This is taken from a movie called On the Band Played On, which was a dramatization of the AIDS crisis that we have known and seems to be a very distant memory. But it's a very interesting movie from the perspective of understanding the politics that goes on between science and researchers and politics on the global stage. And I sincerely recommend this to anybody who may be interested. I do recommend this to students as well. But this was how they continually revisited the topics they're interested in. And when we look at the brain, the macroscopic changes, i.e. what we can see to the naked eye, you can see some profound differences in terms of the changes. So if you look on the left, you'll see an Alzheimer's brain, which is significantly smaller and shrunken compared to a healthy aged brain of the same gender. And then this damage is actually contributed to a great part historically, as it's known by the appearance of these microscopic things called senile plaques and these little tadpole shaped things called tangles. And these are what you'll often hear about as the major kind of causative mechanisms in Alzheimer's disease. A lesser known thing, which is a bit of a mouthful, the cerebral amyloid angiopathy, which this is actually a pathology that exists within blood vessels as well. And it doesn't get the same amount of coverage, but it's highly prevalent in Alzheimer's patients. And it's something that has an intimate relationship with senile plaques, which still needs further work to be elucidated. And we're lucky in Bristol to have a world expert, Professor Seth Love, who's worked for many years in this field. But Alzheimer's is even more complicated than those small microscopic things. We know for now that there's issues with blood flow in the brain. There's damage to the blood-brain barrier, which is a protective envelope ordinarily in the brain to protect us through life from infections and viruses, etc. But it also accumulates damage over time. And that can be partly related to oxidative stress, which can build up due to chemical reactions in the brain that are not working in our favor. And then there's also issues like inflammation, the brain signaling that goes on, the communication between brain cells, the brain energy metabolism is affected. And then you get imbalances in different chemicals that are really vital in terms of maintaining how memories are laid down and preserved in the brain. So to get to the heart of my slightly unusual title, Dementia in Elephants, I mean, I suppose the first question that might be prompted is this about an elephant never forgets and that adage. And certainly elephants are really curious animals. I felt obliged to look into this a little bit further when I proposed this, but they do live a long time. They have huge intelligence. They're comparable to chimpanzees, who we often hear as scientists are our closest relatives. And their brains are very structurally similar to humans. They have a very strong, complex social organization and memory in terms of their survival aspects. And their social interactions are not only with other animals as well, but they also with people, and they can remember some of this time over decades. Elephants are even believed to have their own language, and they're supposed to be artistic and musical tendencies, and even emotional animals. So these are all very prominent issues. We are very salient in humans as well. And a curious thing I found out about these, which I hadn't known about in preparation for this talk, is they do not develop the amyloid like the amyloid plaques that humans develop. However, I'm kind of leading you up a garden path. It's not actually about this. But if that teased your curiosity, I would recommend looking up a very interesting TED talk on this. What I am actually covering is trying to look at this from the point of view of the parable of the blind man and the elephant. So if you're looking at something as a blind person and you're up close to something that's massive, you will tend to look at it by touch. And depending on where you are on that elephant, you'll probably have a different perspective of what you're looking at. And unfortunately, science is a little bit like this. If you think about all the different complex features of Alzheimer's disease that have originated over the years, they all have particular characteristics that have attracted researchers to that area. And as a result, researchers, by virtue of how you have to undertake research and make progressive, iterative progress in a topic, you tend to follow a particular line of inquiry. So as a result, we as scientists arguably have been like these blind men for a long time, looking at a particular part of the elephant without seeing the elephant as a whole. And as you may be not surprised as well, these have given rise to various different hypotheses over the years. The most predominant is the amyloid hypothesis, which is related to the senile plaques, and the cerebral amyloid angiopathy as well to some extent, which has dominated a lot of the research field for years. But I think it's also now fair to say that those individual lines of inquiry have been particularly fruitful, and we are getting to know an awful lot more about the different parts of the elephant. So, as I said, why is it taking so long to find a cure for Alzheimer's disease? And there are several reasons for this. So first of all, again, it's the complex pathology of the disease. It's not just one single entity, it's many. Sorry, my slide's not working. Okay. So to date, we know based on the green arrow, there's only a limited number of medications available, and they essentially just address the chemical imbalances that we know occur in the brain. And there's multiple lines of inquiry looking at some of these other pathways, but they're still in development. The heaviest explored is that looking at the changes that occur in senile plaques. But the reality of it is, because of its complexity, we really need to try and target as many of these as possible and simultaneously to have the maximum effect. Or if we can identify something that's early acting in the disease process or is multifunctional, that is also druggable. And that's obviously quite an ask. So with all these different targets involved, the issues, again, is the slow development of Alzheimer's disease, which was mentioned this morning. So this complicates it somewhat. And this is a slide quite similar to one you've seen early in the morning session, whereby over time, as we get older, we'll have an understandable amount of age-related memory decline. But in Alzheimer's disease and different forms of dementia, you get a very long phase where you see nothing obvious, but there is something going on in the brain with some subtle changes. Then it will progress into something more pronounced, but thankfully not as severe. And then in a proportion of people, obviously it tips into something far more severe. And just to put slightly more context to that, that preclinical phase, as it's often referred, whereby there's nothing particularly evident or outward, that can be up to 20 years in some people. And then you can shift into another phase where you've got mild effects, and that can last for further 10 years before then the inevitable would tip in for some people, unfortunately, to have more pronounced effects that, as the previous speaker told, become evident over time and became worse. And obviously, these are all very different to what you see as a normal course in cognitive aging. I suppose the other element to consider too is this is all against a backdrop where people of a certain age, when they develop these, they've had a whole lifetime in terms of exposures to other things. They've either had a healthy diet and had lots of exercise, or have neither, but that it can also accumulate other diseases or illnesses that can complicate the course of disease, and these obviously become risk factors in time. Another issue with this slow development, it has been a problem in terms of the clinical trials done to date, because the way clinical trials are often undertaken is you have to have a very defined patient population. And up until recently, we've only been able to identify patients based on their symptoms to a great extent. So therefore, a lot of the trials have been done at that stage, but obviously it's way down a potential pathway of accumulative damage over time. So now there is a significant movement to move things a lot more earlier in the process, because that's the place where you can have a greater opportunity to intervene and slow this sort of decline that we know now exists, and try and get in and try and remove the disease processes before they take hold. That has its limitations as well, of course. However, in terms of we need better ways of diagnosing AD to be able to identify and make the best opportunity of these earlier interventions. So can Alzheimer's disease be treated? I mean, it's a disease of the brain, and everybody will be familiar with various different prescriptions they may have had over time, and there's multiple ways in which you're getting a drug into the body. However, we're dealing with something that needs to get into the brain, and with that, it needs to get past the blood-brain barrier, which in many respects has been our friend and ally to protect us the whole way through life, but actually works against us in terms of getting medicines into the brain. So, and the final thing just in this section is to talk about studying diseases of the brain, and Alzheimer's disease and other forms of dementia is more complicated, arguably, than some other diseases, because other diseases, while people are living, they can provide biopsies, blood samples, and other tissue samples that can be studied that don't have a detrimental effect on people. However, of course, in Alzheimer's disease, we need our brains all the time. So sadly, most of the work that's been done to date and where the progress has been made in our understanding has largely come from post-mortem brain studies, and such tissue is available to us through the Southwest Dementia Brain Bank at the University of Bristol, which Brace have pretty much supported since their inception. And it's been key in a lot of research progress to date. So what does the future look like? So in terms of the complexity of AD, which seem to be a tough ask to see how we can overcome, I would say it's fair to say that we are making great progress, and that a lot of the topics we have studied to date, they all are starting to converge. And with that, the hypotheses that have been often pursued independently we're starting to look at those again more meaningfully as well. And they're all starting to join up as well. So as well as knowing more about the individual parts of the elephant, which have been studied for years, we're also getting a better understanding of how they interconnect. How can we combat this issue about the slow development of Alzheimer's disease? Well, as Hilary talked about earlier today, there is significant progress now being made in terms of imaging and different biomarker tests that are available to us, which is buying a significant amount of time to be able to intervene earlier and with greater sensitivity. So we can identify people earlier to be able to do these more targeted earlier intervention studies. So this is all fantastic progress in the right direction. And that's not only that, but in the imaging itself, as well as being helpful in diagnosis, some of the imaging modalities that are available now are so sensitive. It's giving fantastic insights in living people as well as to the disease mechanisms and disturbances, which is a vital, it's a vital complement to what we need to do when we look at brain tissue from post-mortem patients. And then finally, in terms of this issue about getting past the blood-brain barrier, thankfully, as you can imagine, because the drugs need to get into the brain, there's a huge amount of research being undertaken now, and we have a far better understanding of how to use or manipulate the blood-brain barrier to our advantage and of the mechanisms by which materials are normally transported in or out. So there's been significant progress in this as well. Finally, the last comment, and this touches on something which Hilary also mentioned. A lot of people do ask about what can they do to reduce their risk of dementia. And as Hilary mentioned, there was a previous study recently that shows a number of risk factors that have been identified. Hypertension is one particular area we're particularly interested in Bristol, and I've done a lot of work to understand the mechanisms that link hypertension and dementia. And ironically, some of that study has now spilled out into looking at new lines of inquiry in relation to the same pathways involved in head injury and depression, and which also has relevance to diabetes and obesity. So again, echoing what I mentioned earlier about joining the dots, we're looking at one pathway that now addresses several of these risk factors. Another independent line of inquiry is that which Professor Love in Bristol has also been heavily involved at a national level in air pollution. And it's obviously very relevant too in the current climate debate. So we know an awful lot more of what we should and shouldn't be doing throughout life to give us a better chance to avoid dementia later in life. And then finally, just to give people a heads up who may not be aware of this week, the FDA in the US, the federal, I can't remember what the acronym stands for now off the top of my head, apologies, but it will review an application for a new drug called aducanumab, which was presented last year in the US and of which there is a lot of excitement over. It is fair to say that there are some people who still believe the evidence is not as strong as some people would suggest, but time will tell. And this could be the first new drug in 20 plus years. And this will be different to the previous drugs because it's thought to maybe be able to intervene earlier and stop the underlying disease rather than those that currently treat symptoms. So just to conclude, obviously dementia will be with us for some time, unfortunately, but we are edging a lot closer to solving a lot of the questions that remain. The research is really looking beyond just the singular elements and looking to basically join up the dots. Obviously, progress is a lot slower than anybody would hope for, but I hope I've kind of presented that the complexity of the disease explains in part why that is the case. And really, the only way to get through this now is that future funded research is the only way forward. It really equips us as scientists with the opportunities to be able to go and break down the final questions and join more of these dots. And on that, I would like to close and thank Brace for the invitation to present this today. Thank you.
Pat, thank you so much. Before you go, just one quick question. I don't know if everyone lost this, but you just said I don't know if you know this week it's been announced and then you disappeared.
Oh,
Could you
well,
just
that's
quickly
perfect
tell
timing.
us what that was?
So on Friday, the FDA in the US will be reviewing what was an application by Biogen and Lilly, I think it was, for a new drug that interestingly was a drug that was discounted about 18 months ago because some of the preliminary analysis, they call it what they call a futility analysis, i.e. whether there was worth pursuing it. And instead, actually, they found some additional data came through, and they thought actually there was surprising benefits from their drug. So aducanumab is the name of the drug. It's a drug that targets the amyloid changes that occur in the brain, and they're reviewing that for licensing essentially, so there could possibly be a new drug to come onto the market for treatment for Alzheimer's disease. It'll be more likely available to
Fingers
people
crossed.
earlier in the disease process, possibly, but time will tell. But there is, I have to say again, some mixed views as to whether the evidence is as strong as the pharmaceutical company are trying to bring that application forward.
Pat, thank you so much for your knowledge and your wisdom. Really good to hear you today here at the Brace Conference. Thank you for joining us.
Thank you, Ellie.